Hello, and thank you all for coming today. According to a 2002 report done by the Workforce Commission of the American Hospital Association, it is estimated that by 2020, the number of skilled nurses are going to only grow about 6%, and the number of actual patients are going to grow by 40%. This is a big shift in percentages. And you can see on the bottom here is the nurses to grow, and then here are the patients to grow. And in between, it ends up being about 1 million patients that are needing some skilled nurses. This is of such a concern of hospitalized patients that the American Hospital Association, the Joint Commission of Accreditation of Healthcare Associations, and the Institute of Medicine have all expressed concerns and are starting to do research regarding this shortage. I know this personally. When I worked on the floor, I had a patient one day come in and I actually gave them the wrong medicine. Now it turned out the patient was fine, but those are type of things that happen when you are short nurses and have too many patients. Today I want to talk to you about nurse staffing risks, current laws that are in place, and proposed changes to these laws. Now the first thing, the nurse staffing risk, Mark Stanton, who on behalf of the U.S. Department of Health and Human Services did research, and he found that hospitals with low nurse staffing levels tend to have higher levels of poor patient outcomes like pneumonia, shock, cardiac arrest, UTIs, and also death can occur because of this. Mr. Stanton also did, during his research, found that when you have a mean patient-to-nurse ratio between 4:1 or 8:1, he found that out of 4,500 patients, about 230 of them ended up dying because of these ratios. Also, he had found out that if it had been consistently an 8:1 patient-to-nurse ratio, that it's estimated that over 5,000 patients could have died. Now, the actual laws to nurse staffing concerns, they said that an RN should supervise. Now, what they do when they supervise, they determine what type of patient is in the hospital, what kind of care that they need, and then it's up to them to assign how many nurses can handle how many patients. And that is according to the Texas Department of State Health Services hospital staffing rules. Now the bottom line is, we know that hospitals like to save money any way they can. Now a lot of times they'll also use auxiliary staff to kind of fill in some of these shortcomings. Now high levels of nurse staffing could have positive impact on both quality of care and nurse satisfaction. There's a senator in California, her name is Barbara Baxter. On May the 12th, 2011, she tried to introduce a bill called the National Nursing Staff Shortage Reform and Patient Advocacy Act 99. Now in this, it proposes adequate and appropriate quality of delivery of healthcare services and protects patient safety. It also prohibits mandatory overtime if they try to make you work and just to fill up another shift. It's to prohibit that. It also sets specific RN to patient ratios so that you don't have these shortcomings. Now, unfortunately, this law was not passed. It was actually denied and sent to a committee for further review. So, staffing, I would strongly encourage you to, if you are working on the floor and in a hospital, I would strongly encourage you to speak up for yourself and write to your senator. Your Texas senator is John Corwin. I think we need to address this. Let him know our concerns for now and in the future, especially as the ratio gets further and further away from each other. Thank you.